nonprofit based in the United States that is working on alleviating energy poverty and making sure that people who are being left out of market-based solutions during the energy transition have access to safe and renewable lighting. So we, as an organization, I work with 10 NGO partners in 3 countries, so in Uganda, Malawi, and Kenya. And we work with these organizations who already have presences in their communities and already are serving some of the basic needs of community members. And what we try to do is we piggyback onto their existing social service programming and implement energy access programming. So again, I'm with Let There Be Light International in the United States, and I'm going to do the introductions of my organization, our partner organization, the co-host of this session. And then I'll give you a brief overview of the Safe Births Plus Healthy Homes program, which is what we're here to talk about today. So Let There Be Light International is focused on basic electrification. We have 3-tiered programming that includes a gendered lens. So we're very careful and purposeful about including women and girls in our programming. Our programming includes the solar electrification of remote rural health clinics in Uganda, and then the provision of PICO, or individual solar lights, to families and communities in Uganda, Malawi, and Kenya. And we do all of our programming through our NGO partners, who are a critical part of all of our programming. We have to date electrified 63 off-grid health clinics, with 3 coming on board next month. And we've distributed over 25,000 solar lights to homes with elders, students, families with family members who have disabilities, and new mothers and babies. So we do, that's the 2 of those are two of our pillars. So electrification of clinics and then getting lights into homes. The 3rd pillar is the advocacy piece, which is why we're here today, because we really feel strongly that there are incredible opportunities for scaling some of these programs, or for providing the tools so that other people can replicate the programming in their own communities. So we engage in international focus groups on how to get electrification into people's homes and why it is critical. We work in the intersection of health, poverty alleviation, education, and women's empowerment. And so that's what we do. And our primary partner is Solar Health Uganda, which they are, as their title suggests, located in Uganda outside of Kampala in the Wakiso district. They were our first partner and have grown into our primary implementation and thought partner. So they are responsible for a great deal of consulting with us and scaling our programming. They support all of the other partners, and their expertise is really quite significant. I'm going to read a quick intro from Solar Health Uganda that in their own words. So Solar Health Uganda is a Ugandan NGO that provides consulting services in the renewable energy sector. SHU has worked with both international and local organizations, community-based organizations, and local and international Rotary clubs. Solar Health Uganda is committed to addressing energy poverty and combating climate change, and encouraging other NGOs to incorporate energy access into their programming. Energy poverty consultants at Solar Health Uganda work as implementation partners for Let There Be Light International in Uganda, undertaking activities as diverse as conducting outreach and education about renewable energy, conducting needs assessments, solar electrifying rural health clinics, implementing Lights for Literacy, which is a project in which vulnerable students receive solar lights and age-appropriate books while their parents, guardians, and teachers receive literacy training. Solar Health Uganda also collects and analyzes intake and follow-up survey data to communicate impact and refine programming. And they implement Safe Births Plus Healthy Homes, a maternal and infant health project, which we're discussing today. So Safe Births and Healthy Homes began in 2019 with 3 clinics. We now have 5 active clinics in 3 districts of Uganda. The purpose of the project is to improve maternal and infant health outcomes through increased clinic electrifications and safe lighting at home. We use Safe Births Plus Healthy Homes. The plus is a plus sign because it is an additive. We are to emphasize the benefits of moving beyond clinic electrification to include safe renewable lighting for infant care at home. The project was developed in response to requests by local stakeholders, including midwives, community health workers, and a district health officer, who were looking at the programming we were doing and encouraged us to use an incentive of a solar light to improve the attended birth rates in their remote and resource-constrained communities. We have had more than 4,000 mother-baby pairs come through the programming, the Safe Births Plus Healthy Homes programming, and that is impacting more than 24,000 people in these homes. My colleagues at Solar Health Uganda will provide much more data and fill out this picture, but let me mention that although attended childbirth is critical for the reduction of maternal and neonatal mortality, 63% of mothers without formal education continue to give birth without the help of a trained midwife or birth attendant, and this is impacting maternal and infant health outcomes. So without any more ado, I'd like to introduce my colleagues at Solar Health Uganda and have them give you a little bit of information about who they are, how they participate in the programming, and then we'll move on to some other things. Thank you.
Thank you so much, Sarah, for that wonderful introduction about Light International, SHU and Safe Birth and Health Homes project. I also want to take the opportunity to welcome everyone that has joined us today. Thank you so much. We are happy to have you. Caroline Mwebaza. I work with Solar Health Uganda as an energy poverty consultant. And basically, as Sarah mentioned, part of what we do is we do conduct outreach and education, particularly about renewable energy into communities, especially these off-grid communities. We also collect and analyze data. We also participate in solar applications of off-grid health centers, and also a part of the Safe Birth and Health Homes projects. Particularly, we train the health workers and the VHTs on how to collect data and how to conduct the outreaches and education within their communities. Yes, thank you so much. Allow me to welcome other panelists, that is George Mike and Nurse Charity, to say something.
Hello, everyone. My name is Cecilia Charity. I'm from Uganda, and I'm midwife by profession, working with Kyankwanzi District local government at Honda Health Center 3, one of the beneficiaries of Safe Birth Telecom project, which is supported by SAB International. Nice to meet you all.
Thank you, Nurse Charity. Let's have George Mike from Solar Health Uganda.
Thank you so much, Caroline.
George Mike, we can't really hear you. I'm sorry. For those of you, for those of you joining us from not in Uganda, we hope that you'll bear with us because sometimes we do have some connectivity and issues. But George Mike, are you able to join us?
Yes, please. Hi, everyone. I'm George Mike. An energy poverty consultant with Solar Health Uganda. My work with the Solar Health Uganda and Let There Be Light is mainly on evaluation, administration, and outreach education. So I and my colleagues, we do outreach education and we do follow-up assessments and needs assessments. And we also engage in distribution as well as handling data, developing tools, and analyzing the data received from the project sites. And also we do offer advisory services to and technical support to Let There Be Light international partners in Uganda. Yes.
Thank you so much, George Mike. Just a reminder, you can utilize the chat. You can put in your question. We shall be taking note of them, and we shall be answering them towards the end of the session. Thank you so much. We are going to have a short video and then have Nurse Charity. Like she mentioned, she's working at Chikonda Health Center. It's one of the 3 clinics that we first launched on the Safe Birth Plus Health Home project. And she's going to briefly tell us about her experience working with Chikonda Health Center before it was electrified and after it was certified, how the experience was before and after. And also tell us, as she is more engaged with the women at the ground, of administering these solar lights to the women and also conducting the outreaches and following them up. And also she will tell us about her experience about that. Thank you so much.
Carol, would you like me to share my screen now and run the
Yes.
video?
Yes.
Sorry.
The names of Mirembe Oliver, in charge of Vuvubi Health Center. I'm now enjoying the rides, which even I've never dreamed of. Last night I had a delivery, but I used this local candle. But I'm of great happiness. Great thanks goes Let There Be Light International. Now I'm enjoying my work at night. Darkness is no longer a problem. I can handle any emergency. I can conduct deliveries at any time.
Safe Births Plus Healthy Homes Solar Electrifies Clinics. This little light of mine, I'm gonna donate Safe Solar lights to new mothers. This little light of mine, I'm gonna let it shine, let it shine, let it shine, let it shine. Everywhere I go, and educates the community about renewable energy. Safe Births Plus Healthy Homes is a maternal and infant program co-developed by Let There Be Light International and Solar Health Uganda.
Thank you, everyone. Once again, you're welcome. Yeah, I'm a midwife, like I earlier introduced myself, working at Chikonda Health Center 3. Chikonda Health Center 3 is a rural health facility and one of the beneficiaries of Safe Birth Health Home project, supported by Let There Be Light International. Let There Be Light International started supporting Chikonda Health Center 3 in the year 2009. by electrifying the health facility, then by giving out solar lights to every mother who come at the facility to deliver, and then conducting health education talks in the community about safe energy. It was quite a hard experience, me as a midwife, to work at the facility without lighting. I remember by that time we could work only during the day. We couldn't work during night hours because we didn't have light to attend to these mothers. So most of the mothers would come at the facility and would refer them to other health facilities, and of which some of these mothers would lack transport to go to the further health facilities where we would refer them to. So they would end up going home, delivering at home, and which would pose a great risk to the baby's life and the mother's life. And sometimes we would end up losing the baby due to negligence. Maybe if a mother fails to go to other health facilities, they would deliver at home, deliver themselves, and the babies end up dying, and they too, they would get complications during that time. And some of them would opt to go to the TBS and they would use herbs on them. They would end up getting ruptured uterus. So there was a lot going on in our community during those days. And sometimes mothers would come when they are really going to deliver at that time, and you can't refer that mother. So you would resort to using the small torches to deliver these mothers, and of which some procedures are very hard to do on those small torches. Like, for example, if a mother would get a tear, it would be hard to use that small torch to suture these mothers. So most times you would leave them, they would bleed till morning, then you get light to suture them, which was very risky to the mother's life, and which wasn't a good working experience to me as a midwife. Then again, we had security threats at the facility. Since the facility would be very dark at night, thieves would get that chance to come and intrude the facility premises and steal, because they knew there is no one who is going to see them. So they would always break in and take the health facilities, properties, and even us two midwives, we would be scared really to wake up at night to work on these mothers. Remember, when a mother comes and knocks on your door, you don't know who is waking you up. It's really a threat. You can't see the person. You don't know whether they are real patients or they are thieves. You don't know whether they are going to hit you. Like, it wasn't really a good experience to work as a midwife without light at the facility. Then on the part of the community, like, we live in these people who earn less money. Like, some of them, most of them actually use candles or local paraffin, local tadovas, which use kerosene for lighting. Like, these mothers would get fire outbreaks in their homes, because some of them actually live in grass thatched houses. So it would be easy for the fire to catch their homes. So they would have a lot of reports on fire outbreaks in the community. And some of the babies would end up being harmed in these fire outbreaks, and some could even die, which wasn't good. Then again, like, we used to issue out the mosquito nets to mothers who come for antenatal and who come to deliver at the facility, because we live in a high malaria endemic area. But actually, these mothers would not use this net because they live in small houses. So imagine putting a candle and this kerosene light in a house. You put it near a net, there would be a fire risk. So, like, every time they would be scared, maybe the net may catch fire and my baby gets burned. So they would not use it, hence increasing the malaria risk in our mothers and in our children. Then again, some really didn't have money to buy these candles and kerosene lights. like they don't earn what they do. Their work is just digging. So if it is not the season, they can't sell their products and get money. So they wouldn't have lights in their homes. And it's quite hard, like for new mothers, it will be hard to practice exclusive breastfeeding at night because they didn't have light at their homes to help them breastfeed at night. But their life changed since they started getting this light from the Safe Birth Helese Home project. So like as we are facing all those problems, since with the project started, the Safe Birth Helese Home project started supporting Chikonda Health Center 3, there has been a lot of change and a lot of improvement has been seen at the facility and at the community level. Take for example, at the facility, we can work 24 hours, 7 days. We don't close. The facility is always open. So we are always ready to help these mothers during the day and during the night, since we have light to help them. And this has led to the increase in uptake of mothers seeking delivery services at the facility. I remember before we had light at the facility, we could get an average of 18 to 20 mothers per month. But right now, as I'm talking, we get like an average of 60 mothers per month, which is a great improvement we are seeing since we got the solar lights at the health facility. Even our working conditions improved. Like we no longer work on stress. Like really, it would be hurting for you to get a mother at night. You've been attending to this mother all the days during antenatal. You attend this mother before she even conceives. But when they come back to deliver, you tell that mother, no, I can't help you. You have to go away. It's quite hurting. And those mothers sometimes would go back home and deliver at home and get complications. So we would have almost wasted all our energy for those 9 months, taking care of this mother so that we're expecting to have a positive outcome. We need a healthy baby and a healthy mother. So it would be stressing to me as a midwife to send this mother to go back home and they get a complication. Yet all along for the 9 months, I have been preparing for a safe and clean delivery, but because of light, they end up going away. So the situation really changed. Our working conditions have really changed. We appreciate that there is a big change. We can no longer refer those mothers because we can manage to work on them. Then at the facility, we no longer have security threats like we used to have those days. Like the whole facility is lit, even the nurses' quarters. So you can always come out. Even when the mother is calling at night, you can always peep through the window and you see, like, you know that maybe this is a pregnant mother, she needs help. You go outside without being scared that maybe someone may hit you from behind because you can see everywhere. And thieves are scared to come and steal at the health facility because they know there is light. Someone may be seeing them. Then at the side of the community, these mothers are most likely who get light there. I've been in touch with them and I have visited them. Like I've tried to interview some of them. So like when they get solar light, they use the money they used to buy candles, to buy kerosene, they save it and invest it in other activities. Take for example, farming or rearing poultry and piggery. When these animals run bad, they can always sell. When they sell, they can get money and this money can help them to buy many things in their homes. Then again, they can pay school fees for their children and also buy scholastic materials for their children who go to school. That helps to improve the living conditions of the mothers in the community. Then we have increased uptake of use of bed nets. like really they are no longer scared, like my bed net will be burnt, or when I leave the baby inside, when the baby sleeps early, I leave a candle inside, it may burn the net and burn the baby. So like they are no longer scared of that. So that there has been increase in uptake of the bed net use. That helps to decrease malaria incidences in these families. Then there has been reduced cases of fire outbreaks, like really. During those days, mothers would come to the facility without their past medical records. When you would ask them, they would tell you, like, maybe my child health card got burnt in the house, a candle burnt my house. So those incidences have also reduced. We no longer hear those stories at the facility. Then mothers can use solar lights to run their businesses during the night hours. Like it helps them. Like for example, during those days, they would work only during the day and go back home. But when the working hours increase, that means also the income of the home is going to increase, which has also helped these mothers to improve their living conditions. So like even the students can use the solar lights to do their homework. Because like recently they used to use candles or kerosene. They call them tadovas in our local language. So these tadovas produce a lot of smoke, like when you're really using it. I've ever got an experience. I think I've ever used it when I was still in primary. Yeah. Whenever you would do homework, by the time you finish your homework, the eyes would be itching, you're sneezing because of the other smoke coming from kerosene. And it actually doesn't provide enough light when you're doing homework. So you have to stretch your eyes to do your homework. That was not a good experience really to these students who go to school. Remember, you do homework almost every day. By the time the years go on, they end up getting, maybe the eyes get complications. So that is also changing the story in these children's lives. Like now when they get a solar light, they are no longer worried about the effects of the tadovers when they are doing their homework. So they can do it without any problem, really. Solar Safe Birth Health Home project has brought a lot of changes in our community, and those are among the few I've managed to communicate here. But we thank you. We thank Let There Be Light International. We thank you, Solar Health Uganda, for choosing us and implemented the Safe Birth Health Home project at Konda Health Center 3. You're really doing a great impact at both the health workers' lives and the community members. We really appreciate. And we thank you, all the donors who managed to give us whatever you give us. You're really changing people's lives here in Africa. May God bless you. Thank you so much.
Wow, thank you so much, Nurse Charity, for such an informative talk you've given us.
Carolyn, I was wondering if, just for the audience's perspective, if you'd like me to show a tadoba and a solar light so they understand what we're talking about.
It's okay.
Okay, so this you can see this is a typical tadoba, right, Nurse Charity?
Yeah, it is.
And you put the paraffin or the kerosene in this, and then this is an open flame wick. So if you can imagine, when this is lit and burning, it emits this dark smoke. There's light, but not a lot. And it, as Charity was talking about, really irritates your eyes and your throat. And a newborn is very susceptible to pneumonia. And this is a really dirty, and you can hear that's the particulate matter that settles in the bottom. And then this is a typical example of a solar light. It has the integrated solar panel. And then it typically will have 3 different levels of lighting. So sorry to jump in, but I happen to have them and I thought maybe that could be helpful.
Sure, that was helpful, sir. Thank you so much. Because I guess we may have someone in the audience who doesn't know how a Tadova looks like here. Yes, thank you so much for that. I would invite anyone with a question from the audience. You can put it in the chat.
It looks like Kevin might have something to share, which is looks very interesting that we see in the chat. Kevin, did you want to unmute yourself and maybe video if you have it?
Okay, thank you so much, Kevin. Yeah, he was sharing about his experience. He's has been currently volunteering at Bila Health Center, one of the health center that has benefited from Let There Be Light International. It was electrified by Let There Be Light International, and was telling us about his experience while working there. Thank you so much, Kevin, for sharing that experience with us.
Kevin, do you have audio now, or should we just leave it at the chat? We can't hear you. I'm so sorry. But I'd love to catch up with you another time, if that's okay. Carol, did you want me to do the animations now? Oh, you're mute.
Yes.
Okay, great. I'm going to share my screen. I have Let There Be Light has 3 animations that you can visit on our website under our facts page, but we're going to play, they're each about a minute long, and we're going to play 2 of them now. One is of a clinic electrification, and one is a typical kind of, well, animation journey of a woman who has participated in safe births and healthy homes. So here we go. One second, I'm sorry. Let me get that into the larger screen here. Here we go.
Hello, I'm Nurse Grace from Uganda. I love serving my community, but I've been nursing without electricity for too many years. Can you imagine caring for someone in the dark without power? But people count on me to keep them healthy and safe. So I have to use kerosene or my phone to assist during emergencies. Like clinics everywhere, we need reliable power to provide healthcare. Great news! Working with local and international partners, electricity is coming to our rural clinic. We can't wait to stay open 24 hours and provide better care to the community. Today, we're receiving solar energy. Look, the electrician has arrived. This is a big day for everyone. Soon, we'll have safe and strong light. I'm so proud to be working in a modern clinic now. Together, we all can shine on and let there be light international.
Great. And let me get to, oh, sorry. Technical glitches here. We're definitely Oh, for heaven's sakes, I'm sorry. I'm going to stop sharing and then I'm going to reshare because that is seeming to be the way that I can do it. And thank you all for your patience. Oh dear. Well, let's actually not do that for a minute because I'm seeming to, I'm sorry, I don't know what just happened to that. Am I still sharing? Yeah. Okay. All right. Well, I appreciate your indulgence with me, and I will bring up the second one in a second. So, Carol, can you maybe answer or take a couple of the questions that were in the chat while I figure out my confusion here?
Okay, let me look through the chat.
Yeah. Ah, okay. I am able to share the second one now if you'd like me to do that. Yeah. Okay.
Yeah, it's yeah.
Here we go. Great. Thank you. So this is a mother's journey.
How can solar lights change lives? Meet Teresa. She lives in a rural community in Uganda and is about to give birth to her second child. Without access to electricity, Teresa uses polluting and dangerous kerosene to light her home. In Teresa's village, there's a new maternal and infant health project called Safe Births and Healthy Homes. Safe Births and Healthy Homes Solar electrifies community health clinics and donates solar lights to new moms and babies. Nurse Charity welcomes Teresa to the maternity ward at the local clinic. The delivery is a success. Teresa returns home with a donated solar light to keep her and her new baby safer and healthier. Shine on and let there be light international.
Great. Thank you for your indulgence, and hopefully you could see and hear those videos. And back to you, Carol.
Yes, thank you so much, Sarah, for playing those videos, those animations. I'm going to welcome George Mike to give us some reflections about the videos.
Thank you so much, Caroline. From the videos briefly show what happens when we solar electrify a clinic in a rural remote area here in Uganda. So like Nurse Charity has been sharing with you, it's kind of, it is terrible for the health care workers to work without light. So these are the struggles that they have had to deal with all through as they work with the patients. And we need to know that the mothers actually suffer the most because usually actually we have we have learned from the information the health clinics are sharing that most of these births actually do happen during the night. So it is kind of a hard situation for the health workers to support these mothers, to help them deliver in the dark. So these are struggles they have had to go through, but also they put the mother's health and life at risk. The mothers either could get infections as well as the baby if they are working without a light. And still there are complications that maybe would be easily detected if they had a strong light. But it is in most cases not possible because there is no light. And without light, other issues also come along. Without power, the nurses are unable to charge their phones, to keep their phones on. Perhaps they could have, they could think of maybe calling someone for help, maybe to transport a mother. But also without power, they are unable to record, to make phone calls, to ask for emergency help. In any case, a mother has complications that they are unable to handle. So light is really very important. It's really very important. Also, you look at mothers accessing the facility at night, a facility that is in the dark, in nowhere. So there are remote areas that actually where you would go and you wonder where you are going. Actually, we have had, I would share from an experience of one of a hired driver happened to take us, the team of electricians to one health clinic in Chivoga, and the health worker, the driver was like, where are we going? Because it was so remote, like the kind of roads and the kind of, the thickets on the way. So you find that it is very hard for a mother to travel a longer distance going to a clinic where there is no light. But a clinic which has light, which is powered, actually it is easy to access. So you could see it from afar and you are heading where it is safe. So that is my reflection on that video.
Thank you so much, George Mike, for such wonderful sharing. Maybe we can have Sarah add on anything.
Thank you. I don't have anything really to add on, except that it's just been such a privilege to work with such professional and knowledgeable partners, because of course here in the US, we're doing a lot of advocacy and fundraising and outreach around this issue. But it's the people who are able to actually implement the programming with sensitivity and with full stakeholder engagement that makes this such a successful program. And I'm really honored to be a part of it. And I don't know if anybody saw in the animations, but there were some posters on the outside of the clinic walls, and those represent what we've actually done, the teams have done, which is create a poster that communicates what the Safe Births and Healthy Homes program is, and it's translated into local languages. And it's part of the training and the outreach. We haven't talked a lot about that, but the teams are really amazing with raising awareness in the communities about what this project is, why it's important, and that has ripple effects. So when a family that is unaware of what solar energy is learns about these lights, and perhaps a neighbor has received one after participating in Safe Births plus Healthy Homes, there's conversations that then happen around, wow, do we need to keep using these things that are really dangerous and polluting, and so the teams are really careful also about giving information about where people can purchase these lights. So this project is a social safety net project. We are not, the participants do not need to pay for access to the light, but we are hopeful that it is a gateway to people using other renewable energy, or maybe even purchasing a solar home system, which would have multiple lights to even further improve their situation. So again, Let There Be Light is very grateful to have such amazing partners, and Nurse Charity, we're really, really grateful for those of you who are actually on the ground implementing this. Thank you.
Thank you so much, Sarah. Something Judge Mike mentioned about the health centers that we are so like preferring being in the deep rural areas and yet without access to electricity. I can mention like here in Uganda, I think the percentage, we have 26% of people that are connected to the grid, and yet majority of the people, or even the health centers, they are in the urban areas. And then the rural areas, a few of the percentage have access to the grid. So you find it also not even, also the charges of getting connected to the grid are high. So it becomes a challenge even for people in the villages, in those deep villages, because the charges connecting to the grid also are not easily accessible. So it becomes really a challenge to them, and them benefiting or receiving a solar light through this program, Safe Birth and Health Homes project, really impacts their lives deeply. Thank you so much. I'm going to share more. Like as Safe Birth and Health Homes project, though the project is more, we are focusing on SDG 7, trying to have people access the safe and clean energy. You see there's some interlinkages with other SDGs, SDG 3 and SDG 5. You see that through a mother getting a light, and a mother goes with a light at home. Previously, this mother has been using a kerosene or this, we have these wax candles. They emit carbon emissions that really expose or puts the household members at risk of contacting respiratory tract infections. That is the asthma, pneumonia. We have chronic obstructive pulmonary disease. And yet, these respiratory tract infections, particularly pneumonia, is one of the leading causes of mortality in infants, children under the age of 5. It's one of the leading causes. So giving a mother a light, so as a safe and clean light, and she takes it at home, and they're able to use this, and they're able to have clean air around in the house. It actually reduces on the risk of them contacting these respiratory diseases that could really affect their health and also lead to death. And also, besides having that quality good air with them, it also reduces on the stress, actually, especially mothers, because they are the primary caregivers at home, and also they would love to see their family members in good health. It reduces on them the stress and the worry about using this kerosene and the turnover, like being worried. Perhaps the house might catch fire, my baby might contract this respiratory tract infection. So it kind of relieves a mother, and a mother is able to have a good health, not only the mother but the baby too, and the entire households. Nurse Charity mentioned something about their area being a high endemic area for malaria, and really we have conducted follow-ups whereby we see mothers tell us that I cannot use my mosquito net previously because I was using a kerosene, and then yet not using your mosquito net, since this is a high endemic area for malaria, it really exposes them to having malaria, not only them and also their baby. And also, we know here in Africa, here in Uganda, malaria is also among the leading cause of mortality in children under 5 years and also adults. So it really exposes them to that, and it can really affect their health badly. Talking about SDG 5, about how women gender equality. Having this solar light, we have had mothers report to us how, you know, they have this, they have owned this light as theirs. They think like now they have an asset at home, and their husbands feel proud because the mother or the wife came back home with something, with a solar light. It's an asset, and it has really helped the mothers. The ideas and their thoughts. The husbands have become receptive to their ideas and thoughts. Not only that, but also it has empowered them financially. Financially, they're able to save on the money they used to spend on buying the kerosene, reduce on the fuel costs, and they're able to save this money. They can also contribute to the family's income, and also contribute to the economic stability of their households. So it has really empowered the women. They can now have some time and, you know, carry out economic activities using their light, like making mats at night, and they can really earn something out from selling these lights, or from the economic activities they do because of the light that they have received. Yes, thank you so much. I can welcome anyone from the panelists to add on something.
Well, that was really, really interesting. And I put a couple questions in the chat that are things that we've talked about, but I'm also curious. Is there, are you seeing fewer burns, Nurse Charity, in the clinic? And are you seeing fewer cases of malaria, or is that harder to track? And do you need, you know, more of a longitudinal study to establish any causality between the project and the impact? So I know we do track a lot of impact through our data. We're very data driven, but was curious from your direct experience. I'm not sure if Nurse Charity is with us. Maybe one of the other staff members can answer that. George Mike, are you going to answer?
Yes, please. I would share based on the data we are receiving, and most of usually, because besides the data we collect from recipients, we always reach out to in charges of these clinics on a monthly basis, and midwives as well, and as well we have established partnership with the district health department. We know that they keep a record of the healthy reports that they get from these clinics. So based on that, we have been told that there's been a reduction in the fire accidents, the burns, but of course, maybe at a certain point, we'll need to plan to follow up more, because there are other causes, of course, besides the kerosene that do happen in the homes, but specifically to find out whether these burns were associated with kerosene, except for the data that we receive through the follow-up. Generally in the community, we don't have statistics on how that stands.
Thank you. Carol, are you still there moderating?
Yes, there was another question, I think, for Nurse Charity, though. I don't know but if she's on. Nurse Charity, are you able to hear us?
I'm hearing you, Carol.
Yes, there was a question in the chat. Are you seeing less staff turnover currently now at Chikonda Health Center since it was so electrified?
Since Chikonda Health Center 3 was electrified, actually the staff members who come at the facility to work have, the number has greatly increased. I remember those days people used to shy away and run away like, what are we going to do here tonight since we have light? They would go away from the facility and they would say, even if we say we are not going to work at night, we can't work without light. But right now, the staffs are always at the facility. There have been improving the staff turn-up. And even the district has increased the number of staff at the facility because they are seeing that there is a great impact. People are increasing, so they are boosting up the facility staff. So we have had increase in the staff at the facility due to the increase of people seeking health care services at the facility. Thank you.
Interesting. Thank you.
Thank you, Nurse Charity. Maybe lastly, I see another question here in the chat. It's asking about, does the government try to reduce unattended birth rates? And has the government tried are there any other incentives that are helping to reduce unattended birth rates there at Chikonda Health Center 3?
At Chikonda Health Center 3, of course, like there are some incentives, but they are not always enough for all the mothers because the government provides a mama kit to all mothers who come at the facility, but they are not enough. We can get like almost a quarter of the mothers are the ones who get those incentives, and the rest come when they are out of stock, so we can't provide what we don't have. Then furthermore, to explain, like I think Chikonda Health Center 3, since it was electrified, and these people saw that we were giving them results because we have light at the facility. They try to implement it in all the other facilities. The government, the district is trying to provide solar electrification to other facilities which don't have electricity. Since they have seen it working at Chikonda Health Center 3, they think like really they have known that mothers used not to come to the facility because not they didn't want to deliver at the facility, but the facilities didn't have light, so they are integrating it to all the other facilities so that they can be able to give the same services as Chikonda Health Center 3 is giving the services. Thank you.
Okay, thank you so much, Nurse Charity, for sharing that. Like we mentioned earlier on, a Safe Birth and Health Homes project involves a lot of data collections, and we use tablet computers. We have a ComCare app that we use to collect data as the mother is being given a solar light, and also we also follow up with these mothers. So I'm going to welcome George Mike to talk about some of the tools that we use in our programming. George Mike, have you?
Thank you, Caroline. Regarding the tools, like Sarah mentioned that our project is so much data oriented. Reason why we mind about collecting data is because we want to track the impact of our projects over time. So we have developed tools that we use to collect data from recipients, and we always keep track on some of them. So usually we target for the follow-up, the impact assessment, we usually target 40% of the recipients. So when a mother delivers at the clinic, at the time of receiving a solar light, that is when she's being discharged. A health worker or a VHT. A VHT is the village, it's village health team. So he's a member of the village health team. So a VHT or a health worker collects data using a tool that we have developed. We are using software. We are using software whereby this tool we are able to create an application for a VHT to have on a tablet, and we do provide these tablets. So the application is there. So this person collects the data through the application and then synchronizes the data. So it is submitted to our server and it is accessible by Let There Be Light and Solar Health Uganda. So at the end of the month, we look into this data and we analyze, we look at the recipients. So the same is done with the follow-ups. Also, mothers returning to the facility for their 10 weeks vaccination of the baby. Then we do follow up on how on what benefits they have realized from using the solar light, their solar light. So also we use such a tool, tools which we have developed. So over time, Solar Health Uganda, we have learned how to develop these tools and modify them. And we are available to offer any consultancy service in that area for any non-profit that would like such services of developing survey tools. Yeah, we are available. I think that's it. Caroline, I will be brief. I will stop here. Thank you so much.
Thank you, Judge Mike. I can see in the chat we have no questions. I don't know if there is anyone else that has a question. You can unmute and ask.
Carol, can Solar Health Uganda and Let There Be Light put our emails in the chat, and people can always follow up with us later.
Okay, thank you so much, everyone, the panelists and everyone that has attended such an informative discussion about our wonderful project, Safe Birth Plus Health Homes project. Thank you so much for attending.
Thank you.
Yeah. Thank you too.